All right, so I'm gonna give you a really quick and dirty how to do a forehead, because the frontalis muscle is, I always say it's the Achilles heel of injectors, and we all want to do it. I'm doing a ray training right now, so we all want to do it in the same fashion so all of our patients get the same results. So what we do is we're gonna say go all the way up. You're gonna go all the way up from this arch. You're gonna go about 2 finger breaths above the arch. Go all the way up really high. And you're gonna do more of like an intradermal unit right there, and then go all the way up. You're gonna go at the same exact area, same exact, like if you came all the way across. Now, what's a question that we have to ask our patient if I know how many units to go there? What do we have to ask our patient? Perfect. You have to ask them lift or frozen. I can't give you an answer of how many units. Do you like a lift in the brows, or do you like more frozen?
Probably.
More frozen. So I'll probably do about 2 units here if she actually really wants frozen. Go all the way up. If I would ask her to come back in 2 weeks, and I may even have to do half a unit here, intradermal. And I would just tell her, let's just wait 2 units here. I don't want to make it too heavy. But this area right here, 2 finger breaths above that orbital rim, this is where you're gonna start to get the most movement back quick. I actually probably would suspect you'll get it back in about 6 weeks, 6 to 8 weeks, flexible movement here. But flexible movement doesn't mean a wrinkle. It's okay that our face moves at 6 to 8 weeks, that's what we want. But for that first 4 weeks, you will be frozen. So it's all about expectations. Then you're gonna come up, go all the way up really high. We're gonna do a little triangle. So we went from here to here. Do you see our triangle? And then we come up and we do the same thing. So we go into the hairline, because that's actually where we're pulling. And this is our triangle there. 2 triangles. Then you're gonna go all the way up really high. And then I do one right here. Now, if she wanted a sprinkle, I would stop there. I would do 2 units, and then come down here for a sprinkle. I would do like 1 unit, 2 units, 1 unit. And that's just a sprinkle. Now, she wants more frozen. Go all the way up. I'm gonna come in between these and kind of go just a tad bit higher, just a tad bit higher. I do like more of like a zigzag pattern than just straight across patterns. Go all the way up really, really, and I probably just do 2 there as well. So if I did, and then what I do is I look at her muscle and I say frozen, the FDA would say do 20 units. She doesn't have like a crazy big forehead and a lot of movement, so I'd probably come down from that and do about like 14 to 16 units. If she truly wants frozen, I'd probably do around 16 units. And then if she wants more of a sprinkle and flexible movement, I would do anywhere from like 10 to 12 units, do all the units higher in the hairline, and say with the flexible sprinkle, you're gonna get movement, pretty solid movement back around 8 weeks, but it's probably not all out of your system. It's just your frontalis is going to move the first, this is going to move last, and crow's feet are usually what kicks in second. Then they know, they have the expectation when they do get movement back in the frontalis, they look at their glabellar region, they're like, wait, it is still working here. She is right. I don't chew through all my tox at 8 weeks. It's just my frontalis wears off sooner. Does that make sense? Mm-hmm. All right, so that's just a quick and dirty of the forehead. You're good.